have 10 minutes for questions from the committee. Please. Dr. Lau.
Joseph Lau. Dr. Millen, thank you for your presentation. You described the structure and the processes of the DGA committee. The title of your talk is about lessons learned. I wonder what are some of the lessons that you have learned if you're going to, let's say, chair this committee again? What are some of the different things you might want to do with the hindsight of having gone through this process?
Is it on?
Oh, thanks. I think the best way for me to answer that question is to comment on the experiences of the Clinical Practice Guidelines Committee that I served on, and then to contrast that with the DGA's. 3 questions, 5 questions, 5 years, staffing very, very limited in the Clinical Practice Guidelines Committee. In the DGAs, as I said, we had something on the order of 70 staff in the federal framework backing us up, and I cannot emphasize enough how committed, and in many cases full-time committed, those folks were to back up the work of the committee. I'm very proud of the systematic process that we used. I will hold firm that I believe that we used the appropriate methodologies to answer the questions that we did address, that we used the NEL as needed, and right up until going into the last meeting, we were still working on with the committee, asking if we could just tweak, one more round to get clarity on the methodology. And I would say that in my mind, it would be very difficult to think of ways in which the process itself could be improved much. The committee was broadly representative of topics. One thing I didn't emphasize enough is that from the very first meeting, Rick Olson, who's here today, welcomed public input, and we had a process throughout where we mentioned that we reviewed the public comments as they came in, considered them as we iterated on the questions. We actually had public testimony in our second meeting and had something like 60 people who came and commented on what we were doing. And bottom line is that I think that the process is, in the experiences that I've had on various federal panels, one of the most incredible and comprehensive. The sooner the committee can get into the business, if you will, of refining the topics and formulating and prioritizing the questions, the better. I think we did it reasonably quickly, and perhaps that could be expedited even further. But given that this is an entirely voluntary committee, it is, you have to deal with the reality of everything else that people have on their schedule. And I think 6 months initially to really formulate and refine the topics, to identify the themes, to identify and prioritize the questions, and then to think with federal staff about the best methods for analyzing those questions is about as fast as you can do it, leaving then only about 8 to 10 months for the actual reviews and summary of the science. So I wouldn't recommend expanding the time frame beyond the 24-month period. We had 18 months because of some closure in the federal government, but I think 24 months is a reasonable time frame for the committee, and expanding it beyond that, the science moves so quickly, your report would be nearly obsolete by the time it's published. So I think the overall time frame is good, but anything that can be done to really get the formulation of the themes and topics and the initial set of questions and the work translated to the subcommittees would be better.
Thank you. Joanne?
Thank you for this talk, and thank you for the service that you made to the 2015 dietary guidelines. I had a question about your 4-member science committee. As I understand it, the 4 of you actually met prior to the first meeting. Is that correct? Or
Well,
you talked prior to it? And did this 4-member committee, would you constitute it today the way that you constituted it then? 4 members and 2 from the previous one, and 2 the chair and the vice chair. Would you do that? And also, did you make the decisions really for what the overall topics were going to be before you got to the first meeting?
The committee was comprised initially, and thank you for the question and for allowing me to clarify that, was comprised of the 2 folks, Rafael Perez-Escamilla, and Mim Nelson, who were on the 2010 Guidelines Committee, Alice, who was my vice chair, who had served on the earlier, and myself. We met simply to form an agenda and to talk about how best to basically get the work underway, and talked about the potential of identifying work groups and themes to get and to allocate members of the committee as we felt appropriate, given their backgrounds, to that structure, so we could really begin work at the first meeting and not delay it any longer, since we were a little delayed getting started. Once that work was underway, we chose, as leadership, Alice and myself, to begin to expand the membership of that committee to include the chairs of the subcommittees as well. So it was not simply, the 4 of us ultimately making the decision about the lists and the priorities. It was informed also by the chairs of the committee, who were not necessarily on all of the calls that we took, but were invited to be there because we just felt that the additional input would be helpful. So. Mm-hmm.
Other questions from the committee? Yes, Stephanie.
Thanks for the clarity on the process, and it's clear that it was a very scientific process, but my question is, how did you deal with the quality of the evidence? I think we all know, working in the nutrition science field, that looking at nutrition and disease outcomes is not simple. We have to rely on a lot of observational as opposed to randomized trials. There's issues about both types. So how did you deal? I understand you did many systematic reviews, but obviously from my read of the literature, the scientific evidence wouldn't have been outstanding in all of the areas. So what did you do about
So I know, thank you. I know that the committees had and will have, I think, additional presentations on the NEL process and the review, but at each, whatever the source of the outside information, be it our own original NEL reviews of literature, there are several steps in which the quality of the existing literature is evaluated by this national network of people who are actually coding and reviewing and coding the articles and completing these data tables that the committee then reviewed for the purposes of summarizing and deriving their conclusion statements. So the NEL utilized procedures that are used here at the Academy and by research groups around the world. We also
What's the process?
I'm sorry?
How did you then interpret it? So if you have a low level of evidence, medium, high, what did you accept as evidence to base then a recommendation on?
So, for example, when we were looking at existing reports, there's yet another level of review and standardized method that was framework that was used to evaluate the quality of the report. And if we deemed it poor quality, meta-analysis or systematic review of multiple external or published documents. We simply didn't bring that into our review. We relied on what we describe in the report as high quality reports or systematic reviews based upon I think it's the AmStar criteria that were used in that case. Again, there is another level at which we had to think about this, and that was when we derived our conclusion statements and then graded the quality of that evidence. And again, that's a standardized approach that is used broadly by professional groups. And we had to grade each and every one of the conclusion statements based on the quality of that data. But it wasn't even considered as part of our thinking process in our review if basically it wasn't a high quality, say, external report or considered to be a reasonable source. So we had lots of things offered to the committee, both in terms of the NEL process and external and public comments, thousands and thousands of pages of reports from various groups which were reviewed, and if it met the quality criteria, we definitely considered it.
Thank you very much. We're going to move on. Thank you very much, Dr. Millen. I know there are